Hey, it's Dr. Allin here at Evolve Chiropractic Woodstock. We're going to get rolling today on the ground. So one movement that we typically lose the ability to do as we age is roll. And rolling is an extremely important move because what it does is it balances out side-to-side movement, or called cross patterns. So one of the exercises I have patients do once they start moving and feeling better is we're going to start to train rolling patterns. So the best way to do that is to lay on the ground. You can have a little pad if you have a hard floor, but very simple. You don't need any fancy equipment. The only thing you have to do is focus on the movement pattern and work slowly, and over time, you'll get better at it. So we're gonna walk through two different rolling patterns. Now when we do these, you wanna lay flat on your back in a bit of like what's called a star pattern. All right, so maybe 10 to 15 degrees of abduction away from the midline. And in this pattern, we're going to start to roll. Now, what we don't want to do is use both sides. So what I want to say is we're going to start with using only the arm, okay? So your legs are going to be completely relaxed as much as possible here. So from this position, we're going to reach the arm across. Now, we're not going straight across the body. We're coming about, again, keeping that 45-degree angle. I'm going to slightly lift my head. We're gonna pull across. Now as I'm here, I'm reaching until my hip comes up off the ground, and then I can lay flat. So once we're in this position, we're gonna check our position again. We're gonna do that same type of movement. Now instead of coming back this way, I'm gonna bring the arm back behind me. So again, I'm trying to keep my legs as relaxed as possible. And that's probably the hardest part, is keeping the legs completely relaxed until I start to come back over. And then I'm going to slowly bring the leg back down. Now it's important that you use both sides when you're training these. So on the opposite side, again, about 10 to 15 degrees, 45-degree pull across. Okay, and again, now when I started doing this, I started using my heel and pushing off the ground. I don't want to see that. I want to see you using primarily your pec region here into your obliques, into this hip on this side. So as I reach, I'm rolling, and then I'm going to slowly descend back down. Now once I'm here, I'm going to check back in. Arm's going to come behind my back. I'm going to lift my shoulder, look towards that same side, and then we're going to roll slowly, controlled, until we land on the back. So this is an extremely important exercise when we're starting to retrain the body how to move and how to rotate through space. Because again, this is one of the movements that we typically lose when we have neck pain or low back pain. We lose that ability to cross crawl because the body goes into a guarded position. So one of the jobs of rehabilitation is to train the body how to move again. So practice this one. It seems very, very simple, but you'll find it's a little bit difficult the first few times you do it, especially not using your legs. So be safe, have fun, get at it. I'll see you soon.